Hey, what's going on, guys? Excuse me. What's going on? Let's put on here and talk to you guys about South Carolina because I'm about to share a blog about South Carolina. And I said, first, let me come on here and break it down and answer any questions that you may have about that state. And then if then you can go and read the blog and then also have these questions. So first, if you are in the state of South Carolina, let me know, give me the number 1. If you're in the state of South Carolina, let me know, give me the number 1. Sorry, my voice is a little bit scratchy. So if you're in the state of South Carolina, let me know, give me the number 1. And it's just one of the states that's on my list to go over how to get started and to help you as you're searching online, on Google, on YouTube University, and just to break down some of the questions that you have about this particular state. So South Carolina is a great state to start a home care business, and I can tell you from a recent example with one of my home care mentees that excuse me, my voice is kind of really scratchy. That you can get licensed in the state of South Carolina within 4 to 6 months. You can get licensed in the state of South Carolina within 4 to 6 months. So that's the first thing. The time frame for you to get licensed. Now, every state is different. Every state is different. And so whenever you see my videos on how to start and we go step by step through the application process, first I want to let you know the time frame. So this is something that you could possibly get done if you're in the state of South Carolina. You could possibly start and get licensed by the end of the year. And we're going to also go through some of the more popular cities. So first, the time frame, right? So we definitely have it under 6 months, but roughly about maybe like 4 months. The initial application fee. Now, the initial application fee is a little bit on the high side. It's $1,000. We have states that have an application fee that could be $100. Some states have an application fee that could be $500. South Carolina, the application fee is $1,000 for your initial license, and then when you do your annual renewal, the application fee is now $800. Hey, thanks so much for joining. If you're in the state of South Carolina, remember to give me the number 1. And then after this, we will be sharing a blog on our website and on our LinkedIn page for those of you who would like to read through the requirements. And then if you have any questions, please feel free to post them below. I do have an idea of how to submit an RFP to the county. I'm not going over that right now because we're talking about South Carolina. Yes, the application fee for the state of South Carolina, we're talking about South Carolina tonight. So if you do have a question about another state or another thing, please do. You can post your question, but I may not be able to get to it in detail because I want to make sure we keep this video, the content, clean for those of you who are going to come back to this video as a reference. So As always, when you're starting a home care business, there's two things you need to decide at the beginning. Other than, yes, I want to start this kind of business, you need to decide if you want to do a non-skilled, or some people call it non-skilled, non-medical personal care. Those are the categories that non-skilled normally fall into, and that means that you can provide services to seniors, you can provide services to adults, you can provide services to even children, but they don't require someone who has a skilled license, who is an LPN or LVN or RN. Yes, we do help the state of Virginia, and we have a free video on our Savvy Business Chick YouTube channel. And so for South Carolina, the non-skilled license type is what I want to focus on the most today, because if you want to start a skilled agency in the state of South Carolina, you do need to apply for the certificate of need. If you've never heard of the certificate of need, put CON, which is the acronym for certificate of need, in the comment. Fly Mom, that is the license to start. That's for the license to start a non-medical, specifically in South Carolina. So hopefully you're following me specifically for South Carolina. Now, because you asked that question, I also want to cover this, because normally on every Thursday I do calls. I have what's called free call Thursdays, and on Thursdays I get a lot of people that contact me, say, hey, I've already started my business, where essentially they have, and what they're telling me is that they've already got their LLC or their INC, and they have LLC, their INC, and then maybe their EIN number. But in the home care or home health care industry, you cannot officially start running your agency, operating your business, until you are licensed, specifically if you are in a regulated state. Now, I wanted to add a little twist to that. Let's say you're a healthcare professional. Let's say you're RN, let's say you're LPN, let's say you're a CNA, let's say you're a home health aide, and you want to provide service to someone one-on-one care. And you say, hey, someone reached out to me, old client, or somehow you got connected to them, and they're like, oh, well, I'm going to provide services to them directly. You can do that if it's directly, and that it's actually called private duty nursing or private home care. You can do that. But once you decide, well, I'm going to hire someone to work the shifts I can't work, or I need a break and I want to hire someone to work with me on this case, then you're essentially acting as an agency. And if you're in a regulated state, that's where you can get into trouble. So you want to avoid that. And one of the main reasons why I do like to address that is by telling you, number one, what you can do, and then number two, telling you some things that you cannot do, is because we have these Facebook groups, and in the Facebook groups, people share incorrect information. They'll tell you, oh, well, you can do that until you get your agency approved, or they'll tell you you can do that until you can get your money up and be able to afford to start your agency. Because $1,000 is a pretty big startup cost when it comes to licensing fees. But guess what? I didn't come up with that amount. South Carolina says your initial licensing fee is $1,000. So here's some pluses about starting in South Carolina, is that you can start with a home office. So I do like states that will allow you to start with a home office. And some people are like, oh, I don't want my address out in the public, right? And I think when they say that, they think that people, specifically your clients, are going to come to your home. Home care is essentially when we send people out. We send our workers out to work in the client's home. And so you do not have to put your address on your website unless you want to. So just don't put your address on your website. That's number one. Then you cannot avoid that the state is going to publish your license, right? And but it's not like it's so visible where it looks like a face. It's like on like a Facebook page or a social media page, or as convenient as a website. So I don't think that's something you should worry about. I think you should, take advantage of having a low cost startup, um, of minimum overhead, and utilize that you can have a home office and save that money. Because look, if you have to wait up to 6 months, do you honestly want to be paying for a office space of some place you're not using for 6 months? No, you don't. You shouldn't do that. So my advice is to save money. The only time there are states that will not allow you to have a home office, and then those people have to go get a commercial office space. So why not do yourself a favor and take advantage of that? So okay, we're talking about starting a home care business in the state of South Carolina tonight. And the initial licensing fee is $1,000. The It's going to take about 4 to 6 months. We actually had someone recently that got licensed in 3 months. I say 4 to 6 months because we are towards the end of the year, and some states could be backed up, especially with these new regulations. So if you're going to submit it, you still have time. Okay, here I want to go through the requirements for the state. So if you're listening, take some notes. You're going to submit your completed license. You will need to complete a criminal background test and a drug test. Okay. Now, here's the thing. Some people ask me, well, what if I have a smear on my record? They do want the owners to take a criminal background test and a drug test. Okay. So should you not do it if you have a smear on your record? No. Submit your criminal background test as the owner. Submit your drug test as the owner. And if it comes back and they question your, they say, well, this is something that we would normally not approve. You can appeal that. I normally suggest people appeal it and tell them, well, I'm not going to have any direct patient care with my clients. I'm going to hire someone to go out and provide the service. That's worked for some of my other mentees in other states. And then of course, you show that you have someone that's going to be working directly, that's going to be interfacing with the client. Okay, so we got the license fee, got the time frame. You have to complete a physical license application. You have to get a criminal background check. You have to get a drug test. Now, another requirement, which is pretty customary, that shows up in the state is a general liability insurance policy and a surety bond. So these are two requirements that you should take note of. A general liability insurance policy is the general coverage for your agency. It does have to be in your agency's name. The reason why I said that is because some people say, well, I have another business and I have insurance, but it's in my other company's name. Then you essentially would have to do a DBA, do a business as, and make sure that the policy covers your home care agency. And sometimes that can be super, super messy. So I'm like, why do it that way? Why not have a clean slate? The surety bond, I go over the differences of the four insurances that most states will require. General liability is number one. Professional liability is number two. If you have a nurse that is that'll either cover nurses or sometimes it can cover CNAs. Then you have your surety bond, and then you have your workers' comp. These come up pretty often. One of these four Some states may require 3 of the 4. Some states may require 2 of the 4. This state is requiring 2 out of the 4 insurance requirements for you to get. Actually 3. I'm just saying that now. General liability, surety bond, and workers' comp. Let me see. I think I have a question. Let's see if I have a question. Ingrid. Good question. Ingrid on YouTube, on Facebook, apologies. What are the reasons for not being qualified for a home care license? Can you clarify what you mean, Ingrid? You mean like if you have a felony, or you mean just period? Can you clarify your question, please? Your question is, what are the reasons for not being qualified for a home care license? And I just need a little bit more information so I can give you a more accurate answer. Okay. Okay, so general liability insurance, surety bond, workers' compensation insurance. Whenever a state asks for workers' compensation insurance, it's kind of annoying because you're kind of like, well, I'm just starting. I know. So essentially, when you're going to get that type of insurance, just put that it's just you. You're the only worker. And what they're going to ask you is, well, do you anticipate to hire a employee? How many employees do you anticipate to hire? They want to anticipate your payroll, right? Workers' comp goes by payroll. They want to anticipate how your payroll, and that's how much they will charge you. So if you want to have a low workers' comp insurance policy initially, give them a low amount to say, oh, my first year, it's just going to be myself and maybe 3 employees. I would do that, and then after your license, I would adjust it to the amounts, especially after you hire someone. Okay, let me take a little moment. Okay, so Ingrid is saying, in general, what are the reasons to not be qualified for a home care license? Again, that's kind of complicated to answer because, number one, I don't know what state you're in, because if you don't meet the requirements of your state, that's number one, why they would not qualify you for a home care license. Like here, we're talking about the state of South Carolina. If you submit an application with a general liability insurance policy, but not the surety bond, then they would continue to push your application back. And then there is this secret rule that they will give you 3 chances, guys. So I know a lot of people are like, I don't want my application to come back with a whole bunch of mistakes. This is one of the main reasons why people pay people to help them, whether home care coaches, home care consultants, mentors like myself. They get the policies and procedures. Believe me, a lot of those things are really, really good investments because some states are definitely harder than others, right? Some states are harder than others where, to be honest with you guys, you can't just chat GPT your way into creating the policies, right? I did something where I showed how I tested it out with Maryland, which has one of the more difficult and complex policies. I literally copied in the regulation, the little blurb of the regulation, and said, hey, ChatGPT, can you help me write a policy for XYZ? And I showed during a live how when I did that, ChatGPT just gave me a paragraph. And then other people chimed in like, yeah, my friend used ChatGPT and failed her failed their license review. So number two, your reason why someone would not qualify for to get their home care application, home care license approved, policies and procedures. But we haven't even gotten to that point yet. Your policies and procedures have to be matched the regulation, which I forgot to mention that for the state of South Carolina, your the license type that we're talking about tonight is the in-home care providers, right? So if you want to type that in-home care providers in South Carolina, and it's you will be licensed by the South Carolina Department of Health and Environmental Control. And so that the acronym for that department is DHEC. South Carolina Department of Health and Environmental Control. Now, most states, their Department of Health will be reviewing your application. But guess what? Some other states, it could be the Department of Consumer. I don't want to say consumer control, but like I was just helping one of my mentees in New Jersey on Friday. New Jersey Department of, I forgot the last part, the consumer department license healthcare firms. So you need to know, and for this reference, the regulation number is South Carolina for the in-home care providers. That's a non-medical where you can do personal care. So we all know with personal care, you can touch, meaning I can do bathing, I can do dressing, I can do ADLs. Yes, you can touch. You can have CNAs, you can have home health aides. So personal care, that is a good level because that is the level that most seniors, most adults who have those needs are going to need care, right? You can help them with mobility. Mobility is essentially helping them get up and down. Hey, how are you? The topic is how to start a home care agency in the state of South Carolina. How to start a home care agency in the state of South Carolina for those of you who are joining on late. And thanks so much for asking. What are we talking about tonight? We're talking about how to start a home care agency in the state of South Carolina. And it used to be that once a month I would come on YouTube, come on live, and break down step by step how to get licensed per state. Now, because there are going to be some changes in some states in the licensing process, I was like, let me get back to that. But first, let me cover some states that I haven't covered before. And we just got one of my mentees who's a nurse. She just got licensed in 3 months. So under the time period that I mentioned, she got licensed in 3 months about a month ago, right? And we already are on to her marketing campaign, getting clients, right? But in order to be a in-home care provider, that means you can do private pay, you can do Medicaid programs, you can do the VA, you can provide personal care services, companion care services, respite services, homemaking, transportation. You must, and that's because it's a regulated state, be licensed by South Carolina Department of Health and Environmental Control, DHEC. And that's underneath Regulation 6122. And I will tell you, thank you so much for the gifts, that if you're not licensed, what can happen? And it's not pretty. Right? So you don't want to play with these states who already are looking for money, guys, and go do this without being licensed. So again, the application fee is $1,000. Complete your application. The criminal background check and drug test is needed for the owners. General liability insurance and surety bond, workers' compensation insurance, indemnity coverage, right? So that needs to include indemnity coverage, right? You can have a home office. However, your home office, they do want you to have real hours, right? Now, again, not every state will share this. They want you to have real hours. That means they want you to have where they will allow you to have a home office, but the agency must be accessible by phone or in person Monday through Friday, 9 a.m. to 5 p.m. So I want to stress that because let's say you're still working when you first get started. A lot of us are. I know I was. You're still working when you first get started. Then you have to maybe get an answering service. You need to get someone that's going to help answer the phones. You don't necessarily have to hire a receptionist, but you do have to they have to be accessible when they contact you. If someone contacts you, that phone needs to be live from 9 a.m. to 5 p.m. All right. This state has requirements for caregivers. Hey Cheryl, in Illinois, we have a step-by-step guide on Illinois. But at the end of this session, guys, I will take some questions. So I will go through that in a second. Okay, so South Carolina has specific requirements for your staff, for your caregivers. I just want to go through those because they're mentioning these specific requirements. That means that these are things that you need to have when you're looking for caregivers, when you're recruiting your workers in order to be in compliance. Number one, all of your staff, all of your workers have to be at least 18 years old. All of your workers, all of your staff must complete a criminal background check. Okay, but that's pretty standard in most states. Most states will say you have to complete a criminal background check. In South Carolina, all caregivers that work for your home care agency or in-home care support agency must complete a 5-panel drug test that includes cannabis, cocaine, amphetamines, opiates, am I saying that right? And PCP. Yeah, they are specific. They are specific on that one. Let me bring that up. They want that 5-panel drug test to include cannabis, cocaine, amphetamines, I think I'm having something. Opiates and PCP, right? So here's a question I get a lot. Who pays for this? Who pays for this? Guess what? That falls on the agency. Getting this 5-panel drug test falls on the agency. That means you're recruiting someone and this is an even better example. You get a lot of people say, I want to hire before I market, right? In this state, let's say you get all of these, people and you hire them, you're paying this, or the agency is paying for these 5-panel drug tests and the criminal background tests only for you to now go out and market. And then you go out and market, and now that person's not even available. So you just invested your money into people that may not even work for you. Not the best idea, just in my opinion. Then you want to have them have their TB screening, a valid driver's license, and proof of insurance if you have them transporting clients. Let me see if there's any questions real quick. Thank you for liking the live about me, Chick. And thanks so much for you guys that's joining live. Oh, you have an agency in South Carolina for About Me, Chick. Who doesn't show up? Thank you so much. Okay, let me just answer a couple of questions. Is it easier to get a bank loan for the business after getting a license? Not necessarily. Not necessarily. It's not easier to get a bank loan for your business after you get your business license, but it is easier to get it in your business name. So if you open a bank account, this is my experience, guys. If you open a bank account and let's say your initial deposit is like $5,000, some people have it, some people don't. Guess what? When I got started, I didn't have it. I was going to try to come up with something funny. That's the thing. I didn't have it. But now you open up a bank account, right? Let's say you deposit $5,000. It will be easier for you to get to apply for a credit card than a loan, because a loan requires a whole different level of processing, right? It'll be easier for you to apply for a credit card. It'll be easier to apply for a small credit card. They can match your credit card. They can say, oh, we can give her a $5,000 credit card. We can give her a $10,000 credit card. So that's my suggestion since you asked, and then we'll get back to. Okay, Shara on Facebook says, so what would be, and you guys won't have money questions tonight. Okay, like what would be an ideal amount to have in a business account for a foundation start while waiting for the state to approve? What state are you in? And when people say what's the ideal amount, you would have to show me what your budget looks like first, because if you're just having money sitting there, like my thought is like, well, what happens when you gotta spend money? Excuse me, not spend money, because in business we invest money in marketing and getting brochures printed and getting your website done and running social media ads and doing your traditional marketing. So if you're looking for how much money you need to have in your bank account for cash flow, for payroll, that's a completely different question. And then I'll just answer two more questions and I'm moving on. Ingrid said, what are the waiting periods after submitting an application? If you're talking about Pennsylvania, because you said, what are the waiting periods? So they vary per state. If you're talking about your state, I can only tell you that my mentees that use my DIY kit or go through my Kickstarter program, they get their application approved within 8 weeks. So I would say 8 weeks. Okay. Let me see. I don't want to ignore TikTok. Okay. All right. All right. So let me get back to. Oh, yeah. Their work is after you pay for everything. So true. All right. So that is a requirement for the state of South Carolina. We'll come back to questions. Okay. So a lot of states have required training, specifically for people who have non-medical home care businesses. This is embedded into the regulations. So the required training for staff, if you own operated in-home care business in South Carolina, is every caregiver has to have basic first aid, medication assistance, and they need to have training on assisting in medication. That is, giving them reminders, opening up. In some instances, they can open up the container, but can't give. I actually like to give a demonstration, right? So I have to give a demonstration, right? I don't have any pills with me. I like to give a demonstration of this, right? So typically, this is what a lot of seniors use, right? When we're doing medication reminders. Anybody ever seen this before? You seen this before? Give it a number 1. You've seen this before? Give it a number 1. If you've seen this before, give it a number 1. Okay. Medication reminders is a big part of non-medical home care. If you will want to do that, you will want to be able to say you do that. But I want to be clear, this is a little training, we're going to take a little diversion, right? So you can either provide these to the family. I personally, if me and you were on Zoom and I was doing a training and I was telling you, hey, this is how you do your presentation when you're getting your client to sign up for your agency, I would go through this with the client. Let's say I'm sitting across the table with them, right? But tonight, I just want to show you everybody that has this, they're getting a medication reminder. And what your caregiver, whether it's a CNA that's worked at a facility or worked in home care for a long time, even if that CNA is a family member and just went to go get further training, but I know that's my aunt, I know her, blah, 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 blah. And on the family side, when he or she is off the shift, right, they crush their pills, they give them their medication, blah, blah, blah. But when they're working for your agency, the only thing they can do is, number 1, your caregiver can't fill these up. Your caregiver, a part of medication assistance and a medication reminders is that only a nurse or family member can fill this up. Everybody got that? If you're following me, put nurse or family member. I actually want to do a separate training on this. And actually I'm going to have 2 of my nurse friends help some of my wonderful mentees who have non-medical home care agencies with this. This is a big compliance. Only a nurse or family member can fill this up. If you're following me, put nurse or family member or both. Only a nurse or family. Okay, great. All right. And so when you go in to do your initial assessment, and this is going to be a part of the daily care, and let's say you get a sweet case and you're going to be with that client 5 days a week, and even sweeter, 7 days a week, then you want to maybe have at least no less than 2 of these, right? And I would tell the family, let's fill this up 2 weeks at a time, right? And you fill it up with the medication that is needed. Now, here's the thing that most people don't realize. Even if you're a non-skilled, non-medical in-home care agency or provider. Like I said, we're taking a little mini diversion, but I feel like this could help somebody. Even though you're not on the administration side, you should still document. You should still document on your initial assessment what medication the client is taking. Oh, okay. So the client's taking blood pressure medicine, they're taking a water pill, they're taking a liquid vitamin, right? Why should I document it, Sean, if all we're doing is a reminder? Because let's say the client has some constipated. Let's say one of the medications they're on makes them constipated, right? You need to know that, right? That comes up with your caregiver being able to do his or her job, right? Thank you so much for the hearts. Even though you're not a nurse, you're responsible for monitoring changes in condition. And remember, we always say individualized plan of care. Oh, thanks so much for the likes. We always say that, right? But in order for you to do it, your initial assessment, nurses do it better, but I'm telling you this so that you can up your game. If you are a non-medical home care agency provider, you need to document these things in the initial assessment. So again, if I found out I have a client that is going to get 5 days a week of medication reminders for 7 days a week, I'm going to initially ask the family to fill up 2. And I'll say, well, every 2 weeks, we need to have this. We need to have, hey, how are you, beautiful? We need to have this filled up. Now, here is what your caregiver, your CNA, can do. When it's time to remind Ms. Smith to take her blood pressure medicine, your CNA can bring this case that was already filled up to Ms. Smith. Now, it's Monday. Your CNA can do this, right? Ms. Smith, it's time for you to take your blood pressure medicine. Your CNA can put this on her nightstand. Your CNA can put this on the coffee table. Your CNA can put this on the kitchen table, wherever they are. Put it in reach. Put it in reach. Type that in the comments. They can put it in reach. These are things that they can do. Filled up by whom? I just said it can only be filled up by a nurse that is a registered nurse, not an LPN. If you have a non-medical home care agency or in-home care agency, it can be filled up by the family member or a registered nurse, right? I have one mentee in Pennsylvania. She's a registered nurse, and Pennsylvania just has a home care agency license. And the family started off by filling these up, and then they were like, "Oh my gosh, we live 2 hours away. Can we pay you to do it?" Yes, she can do it because she's a registered nurse, and registered nurses on their own can read doctor's orders. And a prescription is technically a version of a doctor's order. It says the order on the bottom, right? All right, I'm going too deep, right? So put it in reach, open it up, but look, you can't pull one out. You can't pull one out. You can't pull one out. They can't pull one out. Nope, none of this, none of this, none of this, none of this. The moment your caregiver pulls one out, even if she's putting it on the table and not doing like this, they have just gotten involved in administration. You can't pull it out. You can put it in reach. You can open this up, but you can't pull it out. Can't pull. I felt like I was like, oh my God, I really have to stress this. They can bring water. They can bring you the water. The caregiver, the CNA, they can bring the water. They can bring the water, right? They can bring the applesauce. They can bring the applesauce that they want to take with it. They can bring the spoon. They can bring the yogurt. They can bring, if they have a peel crusher that they got from CVS or Walgreens or wherever the local pharmacy is, they can bring all that, but they cannot crush the pill. Crushing pills now is administration. It falls into medication administration. They can't crush a pill. They can't crush a pill. They can't put the pill in the applesauce. They can't put the pill in the yogurt. However they're taking it, all they can do is say, "Hey, Miss Beth, it's time." Right? Why can't they do this? They can open it up. They can even open up a pill bottle. Take the top off. Put it right there. Why can't they open it up? Some clients are blind. Some clients are hard to see. Right? Right? That's why this is preferred. This is preferred because then it will say, oh, you're taking the blue pill, the pink pill, blah, 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 blah. You're taking the small pill, or you're taking everything in here. Right? So sometimes people get too comfortable and too excited, especially if it's their first client. Right? So I just wanted to take a little diversion because you're supposed to give required training for your staff on medication assistance. But if you are not a clinical person like myself, I'm not a nurse, never been a nurse, never been an RN, never been an LPN, never been a CNA, never been an HSA. I've never even been a family caregiver, but God blessed me to start a skilled home care agency with a pediatric niche back in 2006, where registered nurses and LPNs worked for my agency, and we provided services to medically fragile children. So I learned a lot as a layperson, but still, I can't train, or change the trach. I've seen how to administer medication into a G-tube. I can't do that. So I'm telling you, you got to make sure that your staff are trained in what they can and cannot do for your agency to be in compliance. Let me move on. All right, so the required training in the state of South Carolina, basic first aid. Now, you don't have to teach basic first aid, but I would have them have the basic first aid certification. That is good for your agency, especially with South Carolina requiring you to have all of these insurance, right? Basic first aid means they know what to do should an emergency occur and assist the client until the ambulance arrives. I think whether or not that is a requirement for your state, I think that a basic first aid is a good internal requirement, period. We got the medication assistance. I'll get to you guys' questions shortly. I don't want to go too long because I do want to cover what's the going rate in the state of South Carolina, and I do want to cover some top cities: infection control, client confidentiality, ethics, and interpersonal relationships. It's very easy if you have a client that is close with its caregiver for things to get a little bit inappropriate. You want to establish those standards at the beginning, and then just kind of reiterate those. Record keeping and documentation. We'll go over record keeping and documentation later, but guys, this is going to be a biggie for all of us in the home care and the home health care industry, because we have to get better with our record keeping and documentation if we want to be successful on the other side of this big, beautiful bill. This big, old, beautiful bill is going to play on your weakness if you are not a good documenter, right? You're not showing that your services are medically necessary, even if the person is getting non-medical services, right? They have a condition that is considered some kind of chronic disease, right? So you have to do really good with your documentation. and record keeping. And some caregivers are really bad. They'll write things like, yeah, I sat and watched soap operas with Miss Smith all day. Well, Dag, why do we even need you here? One moment, Tier, I'll get to your question. Right after this section. Proper lifting and transferring techniques, right? If applicable, right? So when it says if applicable, that means if you have a client that is wheelchair bound or even bed bound, that there should be some kind of client orientation that is documented where that caregiver was shown proper body mechanics of how to lift and transfer, whether it was, using their own body or using a Hoyer lift. And if you're providing any specific care, like Alzheimer's or cognitive disabilities, that specific care should be documented, right? And then it goes on to say in the regs that agencies must document and retain all training records. It's not saying you can't provide your own training. And so that's what I usually try to encourage my nurses. Like, nurses, use your skill set, right? If you're a nurse and you start like an in-home care agency in the state of South Carolina, there's some things that you can share as a nurse to paraprofessionals, right? But they do want that documented. They want to see, oh, we spent 15 minutes on infection control, right? So you document it that a subject was covered, and of course, what we always do is give out a certificate, right? We give out a certificate to show that they completed it and they had an understanding, right? And that is a requirement from the state. They want documentation of all training records with signatures from both the trainer and the trainee. Okay, your question here, would you say it's easier to get children as patients than adults? No, it's not necessarily easier. And that's a really good question. One of the reasons why it's not as easier to get children as patients as adults, because children are considered a part of a protective class, right? So when I did marketing for peds, right, I have to go through a lot of layers, right? Versus if I go do market research with or do direct marketing to seniors, a lot of these lists are exposed, right? I can see their name, but with children, I might have to go through layers because like the parent or the family caregiver comes up first. So typically I learned how to do marketing through disease states. And that's just a little hint. And this is why most of you who follow me to say, oh, why is Sean's marketing so innovative? Why is Sean's marketing so different from other people? I learned how to do marketing by disease states. And it's a really unique way to market, but this is how I normally teach my mentees how to do that. And it's not difficult once you learn how to. We have some training that's kind of like a la carte right now, like how I have a training on how to market to individuals with Parkinson's disease. It's a specific way to market to people with Parkinson's disease, and it's based upon that disease state. And it's based upon who would be my key players if I really want to specialize in getting clients. That would be the same way for pediatric patients, but you would have to know the specific diseases that these medically fragile or special needs patients have in order to find them. So I would say they are not as easy. And this is why, even though I started as a pediatric niche agency for my first 13 years in the home health care industry, I don't share it as much. I only share it when I have someone contact me, when I do my free calls on, and they say, hey, I'm a pediatric nurse and I specifically want to help people, who are medically fragile. I'm going to, let's see if I can. Oh, it's fine. Let me share that. I'll post it later. I thought I could share something. I'm still learning. Share something, but I don't see how I can do it. But yeah, good question. Okay, incident reporting. All right. Incident reporting is going to be a big it's a policy you have to develop, and because the state wants you to report when anytime the client falls, that should be an incident that was reported, and especially if the client had to be hospitalized. Okay, so those are the big points. I am going to have a blog that I'm going to post on my Savvy Business Chick website, as well as my LinkedIn page, for you to read through these things specifically about South Carolina. But this video is pretty detailed as well, because some people do well with hearing versus reading. All right, let me talk to you about the top cities where you will be successful in starting a home care or in-home care business in South Carolina. And then I'm going to get to the rate, the going rate in that state. Charleston, South Carolina, has a booming senior population, and it has a pretty decent medical infrastructure. It makes it equally good for marketing to private pay clients and Medicaid clients. So Charleston, South Carolina is on our list. Columbia, of course, which is the capital of South Carolina, offers a diverse array of clients that need, and they have very, very strong hospital networks that can really drive referrals. So that's why Columbia fell on my list. You say, oh, hospitals can drive referrals. Yes. If you were up here 2 weeks ago, one of my mentees in the state of Virginia, she shared that she got 27 clients in 3 months. All of those clients came from the hospital. From our marketing strategy, we worked with her. Okay, her and her business partner. Greenville has one of the fastest growing cities in the state, and it has some opportunities to reach upscale senior. Like if you want to do like your concierge senior services, people say, John, I want to do concierge senior services. Well, this would be a good city to like try that out in, because it's a fast growing city, so it's a little bit more modernized than the other cities. So that would definitely be a city I would express interest in if you want to start or grow one in. Now, you might have an agency in another part of South Carolina. You might want to go to another area that I'm mentioning to see if you can actually generate additional revenue. Spartanburg, South Carolina offers affordability and access to. This is where you're going to have a lot of seniors in the rural areas that need reliable care. That's good. You know, we hear things like the rural areas are going to get affected by the big old beautiful bougie. I say big old beautiful bougie bill, right? Right. This is good for us. I'm seeing the opportunities. There's this Chinese proverb, or something that says that the same word for crisis is also the same word for opportunity. In Chinese language, the same word for crisis is also the same word for opportunity, right? So they kept saying rural areas, right? In all of our states, we have rural areas, right? So those seniors need somebody the most. So just imagine if you can not only provide assistance to that senior, but you also providing a caregiver a reliable job, right? A reliable job. Then now you're an employer and you're a provider of someone who really, really needs that services. Because um, if they're in a rural area, that's hard for them to get to the hospital, right? So that's going to be good for us or good for you if you are looking at that as an opportunity, as more things of the big old beautiful bougie bill evolve. Spartansburg, Myrtle Beach. Ooh, Myrtle Beach is another area I would definitely suggest doing some concierge services. I can tell you from um, me just coming back from a family trip in Florida. Oh, it was concierge all up and down where we were, right? Concierge automatically means private pay, right? Um, Retirees, no, they flock to the coast. They want to be around water. And then you can also get people that come there with their families. Myself owning a pediatric home care business, you'd be surprised how many people want to bring their special needs child, their medically fragile child to the water. They may not want to bring them all the way down to Florida. They go to places like Virginia Beach and Myrtle Beach, right? So agencies can thrive offering part-time and seasonal care services. If you think there's not riches in niches, meaning seasonal care services, you are wrong. You are wrong. So that's definitely something to consider. Rock Hill, the Rock Hill area of South Carolina has a growing suburb with aging families, and it's easy to access the Charlotte metro area. Rock Hill is ideal for agencies that want to blend private pay and Medicaid services. So new housing going up there. And what I like about the new housing is that you're probably going to start seeing a lot more of those 55 and up communities that are one level. So that's something to look out for. Florence, South Carolina is a regional hub for surrounding rural areas. And this city has a lot of growing need for people who will be dependent on in-home care services. All right, so those are my 7. Let's see. Now let me go to, if you're in the state of South Carolina and you want me to specifically look up your state, post it in the comments. Post it in the comments. Okay. All right. So this is a going rate for South Carolina and the Greenville area. The going rate, and this is according to like AARP, of what people with long-term care insurance policies are currently paying in the Greenville area in South Carolina. They're currently paying $30 an hour for homemaker services and home health aid services. In the Spartansburg area that we just mentioned, people are currently paying $30 an hour for home maker services and $31 an hour for home health aid services. Okay. In Columbia, again, well, $29 an hour for homemaker services and $30 an hour for home health aid services. Oh, we forgot to mention Hilton Head. I forgot. How did that not get on my thing? Hilton Head, boom. Have you guys heard of Hilton Head? Have you guys heard of Hilton Head? $35 an hour, private pay, homemaker or home health aid services. Now, this is not just a guesstimate. These prices are based upon what current long-term care insurance policies are paying out, are currently paying out. So I'm zooming out too much. I need to make this bigger. So we got Hilton and Charleston. $34 an hour. Charleston, South Carolina is currently $34 an hour for both homemaker and home health aid. Myrtle Beach, $30 an hour for both. Sumter, South Carolina, $29 an hour. And Florence, that's the last one, $28 an hour. Hey, Coach E, I want to show you, go show you one at a time so you will know that I'm not making this up. You're like, what is Sean looking at? Right? So we'll just show you I'm not making it up. Okay. Just want to show you, okay? You see, that's the Hilton Head area that I said it was. See, I didn't make that up. And I'm just going to show you one more, and I'm going to show my friends on YouTube. And let's do this one. That's just random. Oh, this one keeps zooming in. 34. Okay. All right. Just to let you know, I did not make it up. Let me show you guys over here. Share screen. Okay. All right. You see this? This was, we were on Charleston. You see that's Hilton Head. These are real numbers. That's Columbia. Okay. Those are real numbers. Oh, delete that page. Okay. I was like, I'm losing my page. Okay. Why I got too many screens open. There you go. Too many screens open. Okay. All right. So I will be posting, I'm going to keep the video up, number one, because anyone that's in South Carolina, I want you to be able to look at this video and be able to get help. I want to share one more thing that used to be a little bit easier for me, but they just changed the way they did this. South Carolina. Okay. Okay, so South Carolina has a larger percentage of agencies that do not offer that are not Medicare certified. So I want you to see that. Let me flip the screen. See? They have more agencies that are not Medicare certified. That means that people are either paying out of pocket or it's Medicaid, right? These areas are mostly out of pocket or Medicaid, right? So that is a good sign for home care services because that means that people and we also probably know why is because remember I said when I first started that in South Carolina, if you want to be a skilled agency, you have to go through the Medicare process. So they're not approving everybody to be Medicare agencies. Why? Because people are only using that for occupational therapy, physical therapy, speech therapy, maybe medical social services. That's what they're using it for, probably more so in those rural areas. I'm going to pick one, let me share my screen. Okay. I'm going to pick one city in South Carolina and see if it'll let me break down I just want to pick a random one. Let's see. King Street or Jones Island. Okay. Now this looks a lot different from how I used to view this. So give me a second. Okay. This particular city only has two agencies listed. One is a home health agency. So that means it's a skilled agency, right? And another one is a home health agency. Just two agencies in that city, right? Then it says here are the nearby cities of that particular state. Let me see. If I flip it, I don't know if you guys can see it good. All right. This particular location has a lot of seniors who want to remain independent and live in their homes, but they need assistance. Should consider, okay, so this is talking to the actual senior, right? It mentions that there are only two home care agencies that serve this particular island. I got to show this to you because from TikTok, I really want you to see it. See, there are only two home care agencies that serve that island, right? If that doesn't sound like opportunity, I don't know what else. These are the only two, right? Seems like this is the biggest one, and they're doing house cleaning, memory care, medication reminders, personal care, medication management, household help, transportation, hospice, right? Even though they're at HHA, look at how many non-medical services they're providing. They're more so on the non-medical side than they are on the medical or skill side. You guys see that? That's telling me something that's telling me something on the light market research. That's telling me that more people in this island need non-medical services, right? They need in-home care support, right? And it sounds like they're not too far from like Hilton Head. So I'm thinking that I could probably charge like 32 to 34, the highest per hour there. And I was trying to see if it was going to show me. Okay, it used to show. It used to show the financial range of people living there, but they changed that. They used to show like the percentage of people who have fixed incomes over 100K, stuff like that. But that's just an example. Cherie, if you're still up here, I try not to mix in when I'm talking about one state, but what part of Georgia is up there. And so if you're still up here, let me know what part of Georgia you're talking about as far as the rate. Okay, so answering, let me answer a couple of questions. So, Cesar, how likely is it that a person may want concierge services in a home versus a big multifamily facility? I'm understanding why would they want a big multifamily facility? I'm not understanding your question. Do you understand the difference between concierge services? Why would they want to leave a home that's fully paid off to go to a facility? You're asking me a question. I'm asking you a question right back. Why would they want? I'm not sure. Are you clear with what concierge services are? Because when we talk about concierge services, we're not talking about like hotel, right? Concierge services is a specific service that is offered in the home care sector. It's specialized services. Okay. Sheree, if you're still here, remember, I just said if you don't want me to share that, just post a 1 or something in the chat because I don't know if you're still here. Okay. Does home care need to complete EIM, incident reportings in PA? What do you mean EIM? Sorry, I'm at mom brain level right now to understand that. Okay. So, again, if you're in the state of South Carolina, I hope this has been helpful for you. If you have any other questions, I'll take 2 more questions before we jump off. If you want to know more about starting a home care business in general, we do have a more thorough training that goes through what I call the 21 steps. These are things like if I was starting a home care agency today, what would I do? If I was starting a home care agency today, what would I do? And these are questions, and this is a blueprint of what I would do from like start to finish. What I would do, things that you may be asking in like a Facebook group, you may be Googling, you may be YouTubing. So that's what I have in my free webinar. If you're interested in that, please click the link in my bio to grab if I want to start a home care, if you want to start a home care business, watch this first. Check that out. And I promise you, I will answer so many questions you didn't even think about answering, and then break down just some things as far as how I would advise you to start and grow your business. Some people are able to help you get started, but they're not able to help you grow. It has to be both. For me, don't get me started. Like, don't get me started and you're not going to show me how to grow, right? I want to see the growth. I want to see how to grow. And a gentleman contacted me today. I think he got a little bit frustrated, right? Because he was asking about Illinois. And in Illinois, the application fee is $1,700. And then he was looking into one of our programs and he was like, oh, I see something here for $2,000. I think he was talking about the DIY kit. And I said, oh, he was like, all of these numbers are confusing. And I'm like, okay, well, let me send it to you in writing, right? But with this webinar, we're not charging anything. We want to just break down how you can be successful in your first year. And I promise you, there's some questions that I answer in this video that you hadn't even thought to ask. So if you're interested in that, click the link in my bio. And thanks so much for joining me tonight. Have a good night, guys.